Hello everyone, and Assalamu alaikum to all my Muslim brothers and sisters who are currently fasting in the holy month of Ramadan. Today I'm going to address a very important question which many of my patients and some of my GP colleagues have also asked regarding the medication which is Empagliflozin, which comes with the name of Jardiance, and Dapagliflozin, which comes with the name of Forxiga, whether they can take this medication while they are fasting for a month, or if they have to fast, whether they should stop this medication while fasting. Before I address this question further, I would like to explain you how these medications work. They both come from a class called SGL2 inhibitor. What it does, it inhibits the receptors on our kidneys called SGL2 receptors, and by inhibiting these receptors, it actually excretes excessive glucose and sodium in the urine, i.e., it prevents reabsorption of both glucose and sodium, hence improving the glycemic control and improving the overall fluid hemodynamics in our body. Therefore, there is broader indication for both these medications can be used in patients with diabetes with poor glycemic control. They are also being used for heart failure patients who have pump failure due to systolic dysfunction or who have a stiff heart and a problem with diastolic dysfunction. In addition to that, it is also used for patients with chronic kidney disease, as it is proven to slow the decline in renal function. Yes, as all other medication, they have side effects as well. The most important side effect, which is rare but can happen, is ketoacidosis. This is a very serious side effect, as patients can get seriously ill with nausea, vomiting and abdominal pains and require hospital admission. The other side effect is risk of urine infection, which is also rare but can happen, and if it happens, we stop the tablet, we treat the infection, and then once the infection is treated, we can safely restart the tablet. But coming back to that serious side effect of ketoacidosis, it mostly happens if the patient is significantly dehydrated or malnourished or suffering from very serious infection in the body. So if you are ill, if you are sick, or if you are severely dehydrated, it is recommended that you stop this medication straight away. This brings me back to the question of whether Muslim patients while fasting in the month of Ramadan can take these medications or not. We need to understand that fasting is compulsory for only those patients who have stable medical condition and they are not seriously ill and not requiring frequent hospital admissions. Those who are stable and had been going well on this medication, they can definitely take this without any trouble. It depends what indication they are taking it for. If you're taking this medication for management of diabetes, then ensure that you are keeping yourself well hydrated during non-fasting hours, around 2 to 3 liters of water divided over various hours in a day. And if you're taking this medication for heart failure and you are on fluid restriction, but you have stable heart failure, then ensure you are drinking at least up to the restricted level allowed. Most of the time, the patients with heart failure are allowed to drink up to 1.5 liters to 2 liters. Whatever your restriction is, you should maintain at that level. Don't drink less or don't drink more. Again, if you're taking this medication for chronic kidney disease, the advice remains the same, that you keep yourself well hydrated during non-fasting hours. In the end, I would like to say that at any stage while fasting, if you're feeling unwell, such as dizzy, lightheaded, or short of breath, I would recommend you break your fast straight away and have something to drink and eat. And if you're still unwell, then seek for medical advice. I hope I have addressed this question. However, if you still have any more queries regarding this, please reply in the message section of this podcast and I will reply in my earlier convenience. Thank you.